I'm a bit mortified that I neglected to mention, I read right over my notes a moment ago, that our links to Atlanta, one of the most fundamental and long-standing, of course, is Senator Sam Nunn, who's chairman of our board and has been dedicated to CSIS mission now for several decades. This panel is an hour-long interactive conversation structured around a number of questions that we will get to momentarily. Let me first introduce our three speakers, and then we'll move to our first question. This is going to be roundtable style, so we'll move through several different questions and ask each of our speakers to weigh in as part of that. To my left is Dr. Thomas Frieden, the head of CDC, director of CDC, familiar to all of you, I'm sure. He's a tireless leader on global health, has an exceptional background as a person who knows the science, knows the politics, knows the policy, has deep field experience both in the United States and in India, and is a person who really in that tradition of trying to use the tools of public health in bold ways to try and bring major transformative changes in behavior and in the health status of the populations that he serves. He's a physician with training in internal medicine, infectious diseases, public health, and epidemiology. He's especially known for his work in tuberculosis control, starting when he was working in New York City in the early 90s when there was a major outbreak at that time, working in the New York health system, and then 5 years in India. He served as the health commissioner in New York City, in which many major programs were introduced with regard to trans fats, smoking, caloric levels, medical records, and the like. So thank you, Tom, for being with us. To his left is Mark Suzman, relative of Cedric Suzman here. And Mark, thank you so much for coming such a long distance from Seattle to be with us. Mark is the managing director at the Bill and Melinda Gates Foundation for International Policy and Programs. And in that role is at the front face of changes that are underway within the foundation, creating much more complicated and more ambitious strategic partnerships with governments, with key provinces and states within India and China, opening field offices increasingly for representation in Africa and elsewhere. This is really a huge dimension of where the foundation is moving for the future and into the future. He came to the foundation from a very distinguished and steep ascent within the UN system. He worked within the office of the Secretary General of the UN on the reform and modernization of the UN at a critical point. Prior to that, in 2000-2005, was working in the UN Development Program in the Office of the Administrator, also in terms of with a focus on overhaul and modernization, making these more effective and up-to-date. He was a correspondent prior to that for the Financial Times, covering, among other things, issues around U.S. policy and U.S. foreign policy based out of Washington. He is holds a doctorate in international relations from Oxford, and was a Rhodes Scholar, and we're proud to say he serves as a member of the CSIS CSIS Executive Council on Development. Thank you, Mark, for being with us. Jada Goyen-McKenna is the Deputy Coordinator for Development in the USD, the Future Initiative. This is the signature one of the signature development initiatives of the Obama administration. Jada has been integral to thinking about it, designing it, going through the painful period of standing it up and staying with it. And we're very grateful to you, Jada, for coming the distance to be with us today, and for the contributions that you've made. As all of you are familiar, launching major initiatives of this kind are always a formidably complicated and difficult undertaking. They involve many different agencies of the U.S. government. They involve sustaining the cooperation and active excitement and support of Congress, and and they involve many complicated external partnerships. And Jada has been at the center of all of that. Prior to taking on that role, her current role, she was really in the boiler room of the initiative as the Deputy Assistant Administrator in what was then the Bureau of Food Security of the U.S. Agency for International Development. Prior to that, she was in Seattle working as a Senior Program Officer in the Agricultural Development Program. When that program at the Bill and Melinda Gates Foundation was taking off. So she was at the ground level there, putting in place really important programs in both Africa and South Asia, partnerships like the Alliance for a Green Revolution in Africa, which have now really become quite fundamental for the Foundation's work there. She holds a BA from Harvard College and an MBA from Harvard Business School. Please join me in welcoming our panelists here. We're going to start this conversation by simply going down the line here and asking each of our three speakers to open with a few minutes, 5 or 6 minutes each, to really talk about their respective institutions' outlook, special assets, with respect to the problem that we put forward here, which is global hunger and the centrality of nutritional insecurity and food insecurity as two fundamental problems. We'll talk later in a second round of conversations about how do you bridge or integrate those efforts. But what I wanted to do right now is to use this as a way of bringing across to you in a very succinct way what are the distinguishing and special attributes of the institutions that we have here who are at the forefront of this effort. CDC, the Bill and Melinda Gates Foundation, and USAID. So Todd, could you kick this off, please?
Great, and thanks so much, Steve, for bringing us all together. Thanks to the organizers, Steve, Helene, Wayne, for bringing us here, and to the sponsors for making this so possible. And it's really a great example of working together, and working together is so important to solving the problems that we're facing. I think I start with the fundamental perspective that malnutrition is both a public health and a human rights issue. And from the CDC perspective, what we try to do is identify problems, identify solutions, identify the programs that will make those solutions a reality, and then establish systems that will hold us all accountable for whether that's happening or not. Sounds simple, right? But actually, it requires us to understand deeply what's happening. And I think there are many different aspects of food insecurity. Although many of us may think naturally of food insecurity as not enough food on the table, there are other forms of food insecurity that I want to emphasize a bit here because sometimes they get neglected. The first is micronutrient malnutrition, sometimes called hidden hunger. And the second is water and sanitation initiatives. And both of those are critically important to nutritional security in ways that aren't always entirely clear. And in both of those, there are big roles that the CDC is playing along with our partners in the public and private sector, in governments and civil society, and that will be essential to progress and to success in these areas and in nutrition generally. So, talking first about micronutrient fortification, about a third of the world's population at least has some form of nutritional deficiency, either a mineral or a vitamin. And unfortunately, that doesn't only cause very specific problems. It also contributes to stunting and poor nutrition and poor outcomes. It contributes to lower performance in schools. It contributes to birth defects. It contributes to lower productivity as a society. So micronutrient fortification, over and over again, every time the world looks at what are the most cost-effective, high-impact programs, it comes out at number one or just about number one. And yet, despite that, it's kind of always the bridesmaid, never the bride. We haven't really scaled up to reach the proportion of the world's population that we could and should, particularly given the degree to which food supplies are industrializing. And that makes it easier to provide fortification. But it's something that only can be done with the partnership of public and private sector, of industry and academia, of the government and the non-governmental organizations. Take a few of these just for example. Iron deficiency anemia. Iron deficiency robs about 2 billion children of potential intellectual development. It contributes to about 1/4 of maternal deaths, as well as about 100,000 deaths overall each year, and it's relatively easily preventable. Furthermore, we know that overall iron deficiency greatly reduces the productivity, the energy of people. Many of us, myself included, have treated pregnant women and children in poor countries and seen the horrible pallor or paleness that results from a lifetime of iron deficiency. That really saps people of vitality. And yet, it wouldn't take much to eliminate that through supplementation, fortification, and home supplementation as well. So iron deficiency is one example of a micronutrient deficiency. Iodine deficiency is another. About 18 million children a year are born at risk for intellectual impairment from iodine deficiency. And in fact, some recent data suggests that even here in the US, we're approaching the edge of what's the acceptable limit for iron supplementation or iodine stores. And children who have iodine deficiency lose 10 or 15 IQ points. A significant impact not only on their development, but on what they can contribute to their community and society. Vitamin A deficiency may kill more than 600,000 infants a year, and yet relatively easily preventable through both fortification potentially, new crops, as we'll, I'm sure hear from the Gates Foundation and others, as well as supplementation programs. Folate deficiency causes birth defects in about 150,000 children a year, and yet again, through supplementation and even more so through fortification, is relatively easily addressed. Zinc deficiency, also hundreds of thousands of preventable deaths a year. The second broad area is water and sanitation. Water and sanitation is critically important not only to promote child survival, but to promote the development of healthy children. Every time a child has an episode of gastrointestinal illness, that sets them back on their growth curve. Children who have those episodes prevented may reach developmental milestones on average about 6 months sooner. They'll go further and faster by having safer water and sanitation systems. And what CDC does in these two and many other areas is to work in more than 70 countries, working with our primary partner, which is the public sector, where we provide support, and ensuring that we have in place information systems that lead to power. Information systems that tell us what's really happening so we can target the populations most in need, so we can figure out if the programs we're implementing are really working. That may mean surveys, it may mean laboratory work, it may mean training epidemiologists, but most of all, it doesn't just mean data. It means integrating data into program implementation. That's the essence of what CDC does around the world, to make sure that when we're implementing a program, we're doing that based on the actual reality of what's happening. Not some theory, not some good idea, not some good intention even, but seeing whether the idea that we have, based on the science that we've studied, will be implemented to benefit people in communities. We do that in more than 70 countries through broad partnerships. On WASH, for example, working with public and private sector, working with NGOs and community groups, training people, showing that whether it's HIV or child survival, improving water and sanitation has a dramatic impact. And where there are programs that don't have that impact, figuring out why so we can help the societies to fix them. We also, in terms of impact, a micronutrient global effort, have been able to double the number of countries using micronutrient fortification. We have much further to go. I'm of the glass half empty school of thought. I would always like to see that last child reached. And so while we've made enormous progress in fortification, in the flour fortification initiative with many of the partners here, we have so much more to do. Currently, fortified flour has made tremendous progress, more than doubling in just the last 8 years, and yet it's still only about 1/3 of what it could be. So we have much more to do, and I think part of our role at CDC is to be an honest broker, is to bear witness to what's happening. Because when we see a number like 2/3 of the flour fortification isn't happening, we see that the result of that is millions of children who aren't reaching their full potential, millions of children who may be stunted or in other ways harmed, who don't have to be, for really just a few cents. And often it's not just the financial gap, which is important, but also the gap of all of us working together. And I think part of what we try to do at CDC is to grow the evidence base of common knowledge, to grow the understanding of what the situation is so that we can work together most effectively. That's what we try to do in these and other areas. We've seen tremendous progress in recent years, driving down diarrheal disease, driving up nutritional status, and yet there's still so much more to do in so many parts of the world, not only low-income countries, but in low-income populations in middle and even upper-income countries. So our fundamental role is to bring knowledge to bear to improve health. And that's what we do in this country and around the world, and we're so fortunate to do that with so many wonderful partners like the ones who have brought us together today and who we work with around the world. Thank you all.
Thank you, Tom. Tell us a bit about the foundation and its outlook and what it's doing.
Okay, now, well, thank you, Steve, and let me add my thanks to Wayne and Helene and all the other organizers for bringing this group together, because it is a fundamentally important issue, and it's at a fundamentally important time. You heard from David Nabarro in the video message and Senator Isakson, and the reason why it's a fundamentally important time is not just because of the need. The need to some degree has always been there. The sort of billion plus people today who don't have enough to eat, and most of those who also live on less than $1.25 a day. But really because of what is in that hashtag that Helene was struggling to get to, but we're going to get her on Twitter soon, is solutions to hunger. Is the fact that we really feel this is a moment in time where there really are a range of solutions in place, or not in place, but proven solutions which are not yet being implemented at remotely the scale and scope that is needed, and ways to actually make these solutions much more efficient, much more extensive, and with a much greater array of partners around the world. And that really, in a nutshell, is what we at the Bill and Melinda Gates Foundation aspire to help do. Really, the foundation is fundamentally in the business of trying to identify solutions to help address the needs of the world's poorest people. The fundamental mission or belief of the foundation is that every person deserves the right to a healthy and productive life, and we look for interventions in areas where our resources and our ability to bring together and catalyze partnerships can help transform that. And the early work of the foundation was deeply in the areas of global health, and indeed our strong partnerships with CDC were built around there in addressing needs, particularly around many of the world's most infectious diseases. And then our transition really happened around the time Warren Buffett announced that his very generous gift that he would be giving the bulk of his foundation to the Bill and Melinda Gates Foundation around 6 years ago now. And the foundation really looking, well, if we were looking at other areas related to health with a direct impact that are subject to this kind of, what would they be? And the more we looked, the clearer and clearer it became it is in this area around food security, hunger, and agricultural development. Because there was huge neglect, paradoxically, even though it affects so many people, and huge opportunity. The poverty-reducing impact of working with smallholder farmers, for example, who make up 3/4 of the world's poorest people, is 2 to 4 times the poverty-reducing impact of other interventions like that. And at the same time, these are the same people who are, you know, the mothers who till the fields, are the same people trying to look after the infants who are at risk of malnutrition in those first 1,000 days, who need the income. And so what we've done is really built up a set of programs across our agriculture, development, and nutrition work, which tries to look what we call across the entire value chain of interventions, which starts at the research and development side, that there's been huge neglect, again, historically into research for the kind of crops and interventions, again, that are greatest utility for the poorest. So lots of research, for example, done into, you know, how you can improve yields and productivity for crops that we're more used to here, such as sort of corn or rice or wheat, a lot less done in areas like millet or sorghum or cassava, which are very important staple crops in these countries. A lot of work done around trying to think, how do you actually train the farmers? You know, there'd been a dismantling, if you like, of extension services in the 80s and 90s in many of these countries in Africa and South Asia where the poorest live. And there's a real revitalization of how do you provide the tools and the techniques to farm effectively and to farm sustainably, meaning more efficient water use. We're now dealing in a context with climate change and other big barriers where this is tougher than it used to be. So you need to combine, and we research, for example, one of the more successful recent interventions we've done is helping develop and work with researchers in India for a new kind of rice we call Scuba Rice, which can actually survive when flooded for up to 17 days and still germinate, which makes a tremendous difference with fluctuating water seasons. That's already been taken up by millions of farmers in South Asia in a very short space of time. And we look for equivalent things like that around drought resistance, higher productivity, and so on. You link that with the extension and training, which is the access to training, but access also to tools and inputs like fertilizer and more efficient water use. And then a critical dimension, which is something that many of the partners in the room here do, is how do you then work on access to markets? Because that's a thing that you can boost productivity all you like, but if there's no way for these smallholder farmers to take these crops and get them to market and distribute them, then you don't have any functioning ecosystem that works. You might be able to have some small improvement on the margin in the household, but really what we're about is increasing productivity of the crops that are actually consumed by these smallholder farm households, farm families mostly headed by women, and also boosting their income. Because the combination of boosting their nutritional food intake and their income actually creates an entire virtuous cycle of development at the household level, which allows them then to put their additional resources into increased healthcare for their children, into access to school, and it's one of the most wonderful things about investments and work in this area is that while you both get the direct results in terms of sort of improved nutrition and livelihoods, you also are really creating a system which becomes self-sustaining. While you need support and international aid and support from philanthropic donors like us to get this up and running, that once the market takes off and once you reach sufficient scale, it doesn't become self-sustaining because you have then some margins of profits which can get reinvested in the farms, reinvested in the training. You get increasing scaling of some of those market access programs. And so in a nutshell, that's really where we at the Foundation have been focusing on, and linking that focus increasingly also to some of the nutrition dimensions like biofortified crops. So one example, just to quickly, is work with, for example, orange flesh sweet potato in Mozambique, which is vitamin A enriched sweet potato, which is a crop that is often used in a drought crop. When other crops have failed, the sweet potatoes will often survive. But what you've had to do in that case, you have households who are not used to eating an orange-colored sweet potato. It looks kind of funny. Why would we do that? It looks a bit bright and neon and shiny. But what we've done with partners there is created a whole system and structure about how you acculturate and train both the farmers and consumers that this is both good to grow and good to eat. And it's actually, I've had the opportunity to visit that in Mozambique with a range of partners, and you have local communities who get together to do new kinds of recipes. They all wander around with sort of T-shirts around orange flesh sweet potatoes. There's actually an orange flesh sweet potato song, which is used to help school children create demand for it. And the point is, it all works. It actually creates, again, one of those virtuous cycles we're talking about, and it's now reaching now hundreds of thousands of households in Mozambique and expanding elsewhere in Africa. And that's one type of example of where we think there's incredible scope for a much, much wider set of interventions. And on the other end, and I'll close with this because I think it will lead a lot into what Jadek will talk about and the work that the US government has started to do, is there's been a very enthusiastic uptake from many, many key governments, especially in Africa, around us, who see the critical importance, who understand that kind of narrative I've just described, and are now saying, we want to do this for our own people. We will put in the resources, we will put in the plans, we will try and put in the networks that encourage in private sector investment. We will look for support from the US and other partners to do this, and that is underway and running. It's still at the early stages. The momentum absolutely needs to be sustained and built on, but it's a really encouraging moment, and it's something that we at the Gates Foundation are very, very committed to being a part of.
Thank you very much, Mark. Jada.
Thank you. Thank you. Thank you, Steve. And I also want to add my thanks to Helene and Wayne. It's great to be able to discuss these things outside of Washington, D.C., here in Atlanta, and it's really encouraging to see such a great crowd here, so thank you for having me. It's important to talk about where we started. I think Senator Isakson laid out the national security imperatives very well. And in 2009, President Obama and global leaders were looking at 1 billion hungry people and upheaval being caused by food price crises. And as someone once said, an hungry crowd is an angry crowd. And the world saw what was going on and responded in force. And at the 2009 G8 summit, led by the U.S. efforts, the world kind of had a real show of force in recommitting towards agricultural development and food security with the $22 billion pledge. The headline at that time was about the funds, but there were also some promises made about how we would do business in that narrative that really underpin the way Feed the Future is run. Later, last year at the 2012 G8 summit, which the U.S. hosted, we again reaffirmed our commitment to food security, and other G8 leaders joined us in that. And in that summit, while we continue the spending that we have on these programs, there was also a recommitment to the results and what we want to see as outcomes of those programs. So at that summit, the new Alliance for Food Security and Nutrition was launched, and we committed to lifting 50 million people out of hunger and poverty, particularly in sub-Saharan Africa, within the next decade. Feed the Future is the U.S. government's global hunger and food security initiative, and our contribution to that effort. In a State of the Union address, President Obama had the quote, it's one of my favorites, "We do big things." And Feed the Future seeks to do no less than those big things. We seek a world without extreme poverty, widespread hunger, and chronic undernutrition, and with a dramatically reduced need for humanitarian assistance. Our focal point to achieve these goals are through smallholder farmers, particularly women. There are two key design factors in Feed the Future that really drive how we work and what we're doing. The first is the integration that was built into the program. So the top line goals of Feed the Future are a reduction in the prevalence of poverty. So we're really driving agricultural-led growth. But the second one that's equally important is a reduction in the prevalence of stunting and underweight children So nutrition has always been baked into our goals of Feed the Future, and it's something that we continue to do in an integrated way. We also are what in DC speak we call a whole of government initiative. So while the initiative is led by USAID, we really look to take the best of what the US government has to offer and work with colleagues from Millennium Challenge Corporation, US Department of Agriculture, OPIC, our Overseas Private Investment Corporation. We have 10 US government agencies that are active participants in Feed the Future. We believe that our mandate is to not only bring the best of the U.S. government to the table, but to really bring the best of the U.S. and what we offer to the table. So in that sense, we work very hard to integrate our private sector into this work, the innovation that comes out of our research institutions, universities, and the practice and the on-the-ground experience that NGOs such as CARE and civil society bring to the table. So in that sense, we are a very integrated effort in how we do work and the goals that we're trying to achieve. The second approach that's really key to us is we believe in working with countries and governments and other institutions in those governments to support their own plans and their own development to achieve these results. We work in deep partnership at the country level. Part of what we bring as a bilateral aid organization are deep relationships and staff and services in the countries in which we work. And we are working with those governments and other institutions in those countries and our own USG partners to really bring transformative programming to them. Earlier I said that women are a key part of the solution and one of the ways that we focus and one of our key focal areas. And there's always more to be done there. One of the things that we are particularly proud of is a tool that we've developed with the Oxford Poverty Lab and others called the Women's Empowerment in Agriculture Index. We look to empower women in everything we do, to make sure they have equal access to production tools and financing, and to make sure that the programs that we're doing are adapted to make sure that women will adopt them and can sustain that adoption. But without a tool like the Women's Empowerment in Ag Index, it's very difficult to get to the bottom of a very complex situation. So this index tracks women's engagement of agriculture in their production, in their ability to control the use of income, of resources in their household, and their access to incomes. When I was a program officer at the Gates Foundation, we'd often design programs to target women's crops, so things that women did. And as those programs became successful, we quickly saw that all of a sudden they became men's crops. And the men's were the ones that were, in getting signed up for those cooperatives and getting the income. So the Women's Empowerment Index also tries to track women's control of the income that comes in from those work, women's ability to access leadership roles. So are they leaders in the farmer cooperatives? Are they leaders in their community doing things? And also their control over their time. If we were to roll out a product that only increased the time burden on women, we will have failed, and we will not have moved the efforts forward. So we are using the Women's Empowerment in Agriculture Index in our work and in our zones of influence, and we've also been working with other organizations to further adapt that tool and to spread it. We are very active on the nutrition front, particularly during the 1,000-day window from pregnancy to a child's second birthday. We work closely with our global health colleagues in terms of driving behavior change, nutrition messaging, but also as we look to the different agriculture value chains that we are investing in, we're looking at how do we get the right protein mix and vitamin mix, what crops will add nutrition to the household, and how do we get those messages through our agriculture work. I was very grateful to Steve in my introduction for talking about the energy it takes to stand up an initiative like Feed the Future. So after doing that, a lot of that work, we're starting to really see the results from our work now that we're fully operational. In fiscal year 2012, we helped 7 million producers adopt improved technologies and management tools to increase their productivity, leading to more resilient crops, higher yields, and increased incomes. We also reached 12 million children with nutrition programs to prevent and treat undernutrition and improve child survival. We have great examples across our focus countries where we work. One example is in Bangladesh, where we worked with them to increase the use of deep urea placement in their fertilizer use. And from that, across 627,000 hectares of land, we saw the first ever rice surplus in an area in one of the poorest states in Bangladesh. We have a progress report for fiscal year 13's efforts, or 12's efforts, that will be out in the next couple months. So we look forward to sharing more of our achievements at that point. Finally, other people have alluded to the food aid reform that currently is part of President Obama's budget, and we're really grateful to partners like Senator Isakson and to CARE and to others in that. Our USAID food assistance program, Food for Peace, as we've evolved our work, that program has continued to evolve. And as part of this budget, we will be able to maintain our leadership as the world's greatest force for good while saving an estimated $500 million by using more direct cash and more modern and flexible approaches to food aid. So in closing, I'd say that through Feed the Future, we're really trying to lead the way in a world in which our shared values drive a collective, comprehensive end to hunger and breaking the cycle of poverty and undernutrition. By supporting stronger markets, better infrastructure, and new technologies, we're really looking to help build resilience and equip communities with the tools, knowledge, and the enabling environment to really thrive in times of prosperity and to overcome the difficulties and hardship, the difficulties in times of hardship. So in other words, by remaining committed to not only doing what's right, but doing the right things well, we think we can make our generation's legacy one of shared progress and prosperity and really ending extreme hunger and poverty as we've seen it thus far.
Thank you. should take a minute and try and clarify for an audience that perhaps is less familiar with what this all means. What are the fundamental issues? We know that when the food aid crisis globally hit in the spring of '08, that triggered an awakening around food instability, food insecurity, production, markets, and the like. And it also reawakened a strong discussion around the way that we go about administering our food aid programs globally, which have been around for 50 or 60 years. This has been a subject of continual debate, but I think it's fair to say that in the last 5 years, that debate has intensified and matured and resulted now in a proposal that came forward in President Obama's budget request. It's now embodied in promising legislation coming from Mr. Royce and Ms. Bass, Representatives Bass and Royce in the House, and of course Elaine Gale from CARE. President CEO of CARE has been a leading voice in the NGO sector. Bill and Melinda Gates Foundation have been very constructive in their own right. So perhaps Jada and Mark, you could give us a quick sort of, in lay language synopsis. What is it we're talking about trying to fix? And why is it so important, Jada?
Currently, right now, most of our U.S. food aid is purchased in the U.S. and then shipped overseas to serve communities in need. There are times when it's very appropriate to bring in foreign food in a time of crisis and humanitarian assistance. There are some times where local food isn't available and those supplies can't get there, and bringing in food is the only way. However, there are other times where that food could potentially distort markets, could distort the food, the markets that are already functioning in those countries, and that by purchasing that food locally or having the flexibility to purchase that food locally, you support local markets, you support local farmers, and you help lead to long-term growth in those economies. Our proposal, the Obama administration's budget and proposal, is simply trying to build on a pilot that was actually started in the Bush administration to increase our flexibility with the use of cash and vouchers with families. There have been to direct cash and vouchers to families to purchase food locally or other supplies that are needed. There have been several studies about this, and in every scenario, the use of vouchers and other means has been proven to be more timely, more cost-effective, and more efficient in helping communities thrive after a time of crisis.
Thank you, Mark.
Yeah, so maybe a couple of additional comments. Just to be clear, I need to be a little careful here. As a foundation, we are actually not able to comment on legislative proposals formally. But what we can talk to and have in the past before some of these efforts underway about what we think are the most efficient ways of achieving some of the results we're talking about. And certainly from our perspective, any type of support that reduces distortions in local markets of pricings by bringing in external supplies, and that helps boost local income while also addressing the needs of the poorest that food aid is intended to do, is clearly a good and efficient thing, and that we're always looking at the best way to sort of maximize the use of your dollar to help reach and meet the largest numbers of people, and we think that the local purchase pilots, such as we've seen them, have been highly effective ways of doing that.
Thank you. Before today, I had the chance to engage with each of our speakers around what they saw as some of the really enduring challenges and problems. We've heard some of this from each of our speakers. In Tom Frieden's case, there were three very powerful points, and I think we heard them. I'd like to ask Tom to say a little bit more. One is the levels of stunting and wasting in large populations that live in extreme poverty. Those levels of stunting and wasting are very resistant to change and very profound. And yet our understanding of stunting remains deficient in itself. And I wanted to ask Tom, why is that, and what do we need to do to really fix that problem? Because that really cuts to one of the biggest problems that we see today when you look around the world at Indonesia or in Africa, where you still have 40–50% of child under 5 stunting, and some of the other South Asian populations and Southeast Asian populations. Tom, could you say a bit more about that, please?
We have so many overlapping challenges: urbanization, population growth, lack of information, lack of infrastructure. Is this on, by the way?
Can't hear. Can't hear.
Don. Hello? I can shout.
Well, while we're fixing that problem,
It's on. Yeah, is that better?
Check.
okay, while they're sorting that out, we're going to hold on that stunting part. and I'm going to move to Mark and to Jada with the question around integration. Sorry. Are we back?
We're back.
Okay, we'll hold on the integration.
I'll have to whisper unless you turn it down a little bit. There's so much that we know and so much that we don't yet know about stunting. It's a horrible problem, not only because it increases child death, it reduces child growth, intellectual growth, productivity, but also because we now know definitively that undernutrition in utero, undernutrition in early childhood, results in what used to be called the Barker hypothesis, but is now proven absolutely that those children will grow up to be at higher risk of diabetes, heart disease, stroke, cancer, and chronic disease. So you really get slammed on both sides. You get less development early on in life, and you get more chronic disease later in life. So what do we know about it? What can we do about it? Well, one thing that we know is that we don't know enough about it. And it does not correlate as neatly as we would think and like with either income or nutritional adequacy. We have much higher rates of stunting in India, for example, than in poorer places of Africa. Now, the reason I've focused a bit on micronutrient malnutrition and on water and sanitation is that we know that these two interventions can make a big difference on hunger generally, on stunting specifically. And for micronutrient supplementation, data has come out only recently, really, in the last couple of years, that micronutrient adequacy in randomized trials can substantially reduce stunting. Similarly, we know that stunting relates in large part to repeated episodes of gastrointestinal infections, which knock kids back on their growth curve and which drive down their ability to use the nutrients they get. So even if you increase the nutrients in, if they're getting over a diarrheal episode which reduces their absorption of nutrients for months, not just days or weeks, which increases their needs nutritionally from fever and other sources, you really are slipping down a slope toward stunting. So taking those two things together, we really can make a difference. And I'd like to just mention some of the great work done with many partners in Haiti. Now, it's not often that you hear the word Haiti and the word progress in the same sentence, but actually we are making real progress in Haiti. In Haiti, we're seeing new vaccines being introduced. The rotavirus vaccine will be introduced this year. Pneumococcal and Haemophilus vaccines have already been introduced, and that will reduce diarrheal episodes, that will reduce stunting. We've also worked with both the health and the water ministries. So we funded more than 250 water technicians to go out to every community in Haiti and make sure that at least where there were water purification systems, they were working. You know, it's relatively low-hanging fruit. We've worked with the health ministry to help them track what's happening so we can have systems to monitor. And I think that's something that we really need to understand. It's not enough to run programs. It's not enough to do monitoring. You have to run programs that intensively monitor whether they're working for a few reasons. One, so you can identify populations for which they're not working. Two, so that if they are working, you can defend them and you don't stop them because you think, oh, they're not making a difference. And three, because frankly, sometimes they don't work as well as we'd like. And when you identify that, you can then scale them up to work better. But I think there is still a lot that we don't understand about stunting. And just as it's such a tragedy that a lot happens around the world that we don't understand, that's a reflection of our values. That's a reflection of what we care enough about to understand better. So figuring out what is driving stunting, I think, is crucially important, not only by doing studies to analyze it. You know, we talk a lot about evidence-based practice. So we want to prove something works and then scale it up. And we're working on that in the case of micronutrients, in the case of water and sanitation, and in many other nutritional interventions. But there's also evidence-based practice. Practice-based evidence, where you implement something and see if it works through rigorous analysis. And that's some of the emerging data we're getting on what can be done by combining some of these initiatives in low-cost, sustainable ways that involve the industrial producers, that involve the private sector, NGOs, government, research institutions, to figure out what's happening, to implement the program, to document it works, and then to figure out how to get it from a pilot that just helps a small number of people to a program that helps all children in society.
Thank you, Tom. Mark, when we spoke earlier, it's very clear that the Foundation has made a major change internally in trying to integrate its health, nutrition, agriculture development, long-term development outlooks, and bring much greater cross-fertilization internally, while also extending the reach into the regions where you're making your greatest investments and having closer on-the-ground relationships and partnerships and presence and understanding. Those kinds of alliances, all very ambitious and all moving fairly rapidly. And in our conversations, you said, when we talk at a rhetorical level about the need to integrate the investments being made in food security and the investments being made in improving nutrition, it makes intuitive sense, but it can be very difficult to carry out. Can you say a few words of why is it that it's difficult to do that? Because it's a powerful, intuitive concept, and it's fundamental to the whole premise of what we're trying to talk about today. So if you could say a few words.
Thanks, Steve. I think it's a great question, and as Steve says, it's an issue we are wrestling with a lot at the Foundation. In fact, with David Nabarro's remarks, I think you heard a little bit about, he didn't state it quite like that, but the challenge of how do you bring the right coalitions of actors together around implementing these programs? Because I think part of the answer is, while, as Steve says, it's intuitive, everyone gets the connection between agriculture grows food, nutrition is ultimately about the consumption of healthy and nutritious food intake. And so it makes a lot of sense. But when you try and join it up and think, well, what are the right sets of interventions to help address that, and how do we put it gets trickier. So the two just global programs that we've talked about, and I'll put Jada on the spot coming up next, but you've got the Scaling Up Nutrition initiative that was called, and you have the Feed the Future initiative, which have basically been launched simultaneously. And there are things, but there are struggles. If you actually look at it, and these are addressed at country level, at the country level, how do countries then say, if I'm putting together a plan, how do I link the two sets in? What are the right kinds of investments that should flow? And actually, Jada and I were both in Cape Town about 10 days ago at this World Economic Forum for Africa, which is an event that brings together leaders from across the continent around this. And there were a bunch of discussions around that, a number of key African countries who are thinking very actively about their agriculture programs. And to use one example, a conversation I was able to have with President Kikwete of Tanzania, who really is one of the leaders of these efforts. He both is a co-chair of the Scaling Up Nutrition effort, but is also one of the champions in Africa of how you put together what they call a comprehensive agricultural development program, which is something that all African countries are committed to do, which is trying to look at what are the sets of interventions, how do we map it around the crops, the areas, the partners we bring in. And it was really talking with him about how do you put the two of them together. And I think the starting point at that level really is at the country level, because you've got to look at what's happening there, how are they allocating their resources, and the communities which they're trying to address. It's the same smallholder farmers and their families, again, as Jada says, largely women in this case, who are having to think about these things together. And so at one level, it's the implementation planning, and I think we're now making some really good steps there, but we're looking to the country level area to help drive those plans and examples. And our hope is Tanzania, for example, which is over 40 million people and 80% of them still rural, is a sort of perfect case study for that kind of set. At the other end, it's also at the understanding that the science and the R&D and the research end and across our teams, where, again, we know there are links to but the kind of things I was talking about, like some of the biofortified crops that you're looking to develop, the orange flesh sweet potato example, but we also have investments around biofortified, bananas, rice, other types of crops is one set of interventions which are quite promising that can link in there. And another is around dietary diversification. So you can have the same crops, but do you have farmers actually growing the right combination of legumes, sort of beans and pulses, as well as the classic staple carbohydrates, which might be sort of rice or corn or wheat. And so all of those need to come together. And the fact is, it just has been a little bit de facto in kind of these parallel silos, even within the foundation and in the global community. And I think in the last couple of years, there's been a very encouraging coming together around that, but we're still at the relatively early days for how we make that happen and identifying what really are the best practice examples. Again, in many cases, bringing in sort of strong private sector partners, and from the food processors to the seed distributors and manufacturers about what that looks like. So early days, but probably not as far in doing that as you would think we probably should be.
Thank you. I mean, it does strike me that the Feed the Future initiative, which is so ambitious and so important, it's still early days in some ways, right? I mean, the PEPFAR program has been with us for almost a decade now. You could say that Feed the Future, in terms of its evolution, is really in its third or fourth year of full throttle implementation. You mentioned in your remarks how difficult it is to go from rhetoric to reality and tracking the gender dimension, and having a gender implementation strategy that has real metrics and a more operational strategy. We've talked about how do you, in our conversation, how do you make sure that when those farmers become more prosperous, they don't immediately up and migrate to the town, but they find other off-farm employment opportunities. So that's where you get into private sector agro-processing. We've also talked about these are long-term investments that require proof of concept to sustain the interest of Senator Isakson and other members of Congress that go to the well every year and defend all of these. This is a long-term project, so sustaining political will at home and globally becomes a big, tricky issue. And both you and Mark talk about the countries where you're seeing progress as the place to look in order to see where integration might work and how you can say, we are in fact achieving something significant. And you talked about Tanzania, Bangladesh, Ethiopia. Maybe, Jay, you could put it in context in terms of where are we along the game plan, and what's happening in those countries as you try to tackle these big problems that you see.
Yeah, one of the challenges with Feed the Future is that when you're talking about things like hunger and child, we don't have the sexy number like a PEPFAR has, right, in terms of number of lives saved because of antiretroviral drugs. I say to people, I need time to get things to grow out of the ground. It's a little bit tougher, and talking about yields and yield improvement just isn't as sexy or exciting in terms of getting that traction. So I think you're right. We are in our early days, yet we are still seeing results. The countries where we're seeing the greatest improvement, and you mentioned them, Tanzania, Ethiopia, Bangladesh, Ghana is actually making great strides on several fronts, and agriculture continues to be one of them. some of the characteristics they have in common are very strong engagement from the very top of the government, so a real commitment to make things work and to drive results, as well as very active communities of people, either civil society or NGO, or an engaged local private sector that really is working in tandem to get things done. In Tanzania, President Kikwete, one of the things that propelled him was a coalition of local private sector companies and international investors that came and said, look, we want to do this work with you. We want to serve smallholder farmers. We want them to be their customers. We want to serve them. We want access to them. How can we work with you and your government to make that happen? And so it really does become a community effort, and it's important for that. You know, we're working in Mali right now, where there has been some instability in the government now, and we're seeing it's really important to work in local communities and with other actors so that you still have momentum that carries through despite leadership changes and transitions, because it really is a shared agenda. So we're seeing that in those countries. I mean, it's important to us as Feed the Future that we get the integration right across sectors, because that's what we're asking the governments to do as well, right? There are bureaucratic silos like the Department of Health or the Department of Agriculture that we work internally in the US government. We've developed a scorecard that is on our website, feedthefuture.gov, that really lays out different actions that different agencies are supposed to be taking and what we hope the results are at the end of the year, what our projections are, and then what those results are. And so by kind of having shared goals and shared metrics, that allows us to track them, even though we all report to different committees in Congress and different masters. The other thing that we are working hard on a global level, but that impacts in country, is really bringing together the movements. Like Mark talked about the Sun movement, which is a global movement, versus Feed the Future, the US government's initiative. But you know, there have been some push that everyone wants to see their flag and their name at the top of an initiative, right? We've had requests to have a branded line item in the budget just for nutrition, or nutrition coordinator, if there's a Feed the Future coordinator. And in the reality, we want to integrate those programming. We want people to be having the same mutual goals. And so sometimes we have to be careful as we modulate those requests for everybody waving their own flag to really making sure that existing programs and efforts are integrating and taking those on as their own. So I think that's something that we struggle with and a challenge. The other part that we are continuing to work on is showing the impact and the results from the interventions that we're seeking people to make. So with nutrition, we're constantly working to improve the evidence base for how different actions improve nutrition. You know, as Tom said, just increasing incomes alone is not a direct correlation to improving nutrition outcomes. And so looking to measure what those correlations are and how they've happened also help us to get more support and more success stories coming out of those. So working on the evidence base while we do the implementation is actually a critical part of what we're doing. But the focus for the long haul is important. We are in Feed the Future for the long haul. We are the nutrition agenda. We're there for the long haul, and kind of having patience, knowing that sometimes there'll be dips, but that we constantly are doing this in a way that we're learning, and a learning agenda to improve things, and being transparent about both the successes and the failures to the public, I think will take us a long way.
Thank you. I'm going to come back to our speakers and ask them to offer some thoughts about future goals. But while they're doing that, if people would like to come to one of the two standing microphones and offer some, we'll have a little bit of time for some very short interventions in terms of comments or questions. This field of global hunger that brings in all these different dimensions, there's a lot we don't know. There's a lot underway. There are multiple institutions involved. You can bring in almost any dimension into this discussion when you start talking about global hunger. So one of the challenges is, how do you communicate what your top line goal or goals are to an American public that says, okay, I see global hunger as a problem. What's our goal or key goal in the next 5 years or 10 years? Is there a moonshot in there that you can communicate credibly to an American public given all of these other considerations, we don't control everything. There's a lot we don't know, like. And so I wanted to ask you your advice on that, because I think that's very important when we get around to trying to raise global hunger as a focal priority of global health. It then becomes, okay, so what is the goal? Tom, would you like to try your hand at that? We'll quickly go through our three speakers, then we'll come to our questions.
The essence of public health is a system that holds everyone accountable. And really, technically, it's not terribly difficult to establish a system that monitors nutritional adequacy globally in closer to a real-time basis than we have now. And if we've learned anything about program implementation, it's the shorter the cycle time with data feedback, the more rapid the improvement in programmatic effort. So I would just say, looking at quick, accurate, representative ways to look at undernutrition, and then using that in real time, not every 3 years, but every 3 months, to feedback and improve programs and have those information systems be owned by countries and communities is crucial to rapid progress.
Thank you. Mark?
Let me put it at the flip end of sort of Tom's focus, which I agree with completely, and say, really, I think the aspiration and the goal, and it's a doable goal, is in the years ahead to give millions and ultimately hundreds of millions of poor families the tools, the training, and the access to markets to feed themselves in a nutritionally enhanced way that looks after their children, and to create the income and other development outcomes around that that make it sustainable in the long run without the need for continued international assistance.
We try to have a set of intermediate goals or intermediate outcomes that we hope will help focus attention. One of the top things that we're looking at is 50 million people out of hunger and poverty within the next 10 years as a starting point to ending extreme poverty. Also look at things like technologies adaptation, like improvements in crop yields, hectares under improved yields. So we've tried to break it down into tangible things that people can see and track progress on over time.
Thank you. We have 10 minutes. What I'd like to ask, we have five folks in the queue. What we'll do is bundle together your comment or question. Please identify yourself. Welcome. Please identify yourself. Be very succinct. We'll bundle those five, and then we'll come back to our speakers and I'll give them a chance to respond, and then we'll wrap up. Sir?
Good morning. Good morning. Thanks for the opportunity. My name is Harry Young. I'm a graduate student at Georgia State University. I'm also Deputy Director of a program with DAN International, which works with CDC. So my first point is, one of the examples that I've seen is Haiti, where the development of institutions have become parallel to the official and to government institutions. So NGOs are setting up structures that run parallel to. That's been one of the critiques of the issues in Haiti. So maybe you all comment about working in countries where there's perceived corruption or maybe real corruption, and that struggle between how do we get stuff done using our own infrastructure as opposed to using local infrastructure and creating local infrastructure and institutions.
Thank you. I'm sorry.
Second, very quick
please,
point
one question. Sorry. I'm sorry, we've got 6 people we have to get through, so. One
sentence. Role of social media in public health. Very important. Infants in the U.S., any role for it in international?
Thank you. Please limit yourself to one quick question or comment. Sir.
Steve Stice, University of Georgia, College of Agriculture, and a grantee from the Bill and Melinda Gates Foundation in the livestock area. Livestock plays a huge, important role in world hunger and poverty. The Bill and Melinda Gates Foundation is increasing their activity in that area significantly. It leads to increased income for women as well as nutrients for people. So my question is to the CDC and the Feed the Future, is livestock on your radar in the future?
Thank you. Yes, ma'am.
My name is Tiffany Jones, and I'm with the University of Georgia Cobb County Cooperative Extension Office. And my question is, how can we get the schools in poverty areas to get involved in sustainable agriculture and water? If you start with kids in elementary school, they can learn the processes of plants and how they grow, and they can begin at the school systems, starting their own gardens. How do you get them involved? Because it deals with health, it deals with science, math, and reading. You can tend to all of those things in education, along with teaching kids how to grow food and take care of their own families.
Thank you, Ms. Johnson. Yes?
Hi, my name is Morrison. There is a major discrepancy between policy development and the goals in which you are attempting to achieve. For instance, Ms. Tijara, you mentioned that you buy rice from the US and you sell the rice, basically you dump the rice in Tanzania. So how is it that the Tanzanian farmers could compete with the US subsidized rice? Another policy contradictory is the WTO. If you look at it, it should have been a partnership program. Only partnership can get people out of poverty, but it's mostly a submissive program in which the richest you are, the more powerful you become. So perhaps you might want to reconsider your policy development as well as the implementation. And one suggestion, Africa is a major continent. There is very many countries in the continent. So whenever you talking about, giving an example, poverty, war, crime, and you mention Africa, you basically painting negatively to an entire continent. Perhaps you should be more specific about the countries in which you are addressing. Thank you.
Thank you. Yes, sir.
Good morning. My name is Benson Nsomara. I'm quite passionate about food security, particularly in Africa. And having lived in Nigeria for many years before coming to the US, I also, just by observation, found that there were specific areas that required improvement as far as farming techniques is concerned in Africa, and let's say Nigeria, because that's the area I was very familiar with. You have things like distribution systems that the gentleman from the Gates Foundation spoke about briefly. Just in terms of how quickly and properly food that is produced gets, to the market and people that need them. And then you talk about preservation techniques. I remember that back there in Africa, you have situations where food is produced, but because of poor preservation, the food just lays there in heaps and then gets spoiled. And then there's the issue of just mechanized farming. You find out that in most places, the farming techniques, farming is still being done on a subsistence level. So farmers are using hoes, cutlasses, very primitive equipment to produce their food. And this limits the quantity of food that can be produced. So the question is, in your initiatives, in your policy generation, and your attempts to improve food security in these regions, what attempts are made to improve the farming techniques, so that they can mirror the kind of techniques that you have in Europe, in the US, things like subsidies, harvesters, combines, and all those techniques that will actually improve the ability of Africans to produce food for themselves.
Thank you. Yes?
Yes, I'll try to be fast. I have 3 points. One is,
Please just give us one quick comment question, yes, and then we'll come to you, and then we'll come back. We're running out of time, so please.
Okay, I think are we using the mass media? Really, are we using it? Globally, country level, and local level. I don't think we are doing it. We can really push much more in the media.
Thank you. Yes?
Hi, I'm Maria Kasparian. I'm with Indicia. We're a non-profit producer of ready-to-use foods like Plumpy Nut and home-based fortificants like NutriButter. We're following very closely food aid reform ideas, and we're very supportive of it in the sense that we also support local producers of these foods who are mostly factories based in Africa, Asia, and Latin America. My question is if you could clarify a little bit the difference between Dr. Shah's proposal to impact the current appropriations bill versus what I've just seen, the Royce-Bass Food Aid Reform Act proposal. So the legislation approach versus the appropriations approach, and kind of the
Thank you.
Thank you.
I'm going to ask, many of these questions get parsed out among our speakers, and some of them are more common. Tom Frieden is going to have to pull out for another engagement shortly, so I'd like to ask him to open up with his response to whichever of these questions are relevant.
Well, I guess I'd like to first agree fully on the comment on Africa. The diversity among countries and within countries is so enormous, we really have to get specific. And that's why at CDC we have country offices in many of the countries where we work throughout the region. And the focus of those offices is to increase the capacity of the government, not just to run programs, but to interact effectively with the private, with the nonprofit, with faith-based sectors, which are so important in those environments. What we aim to do is to establish capacity that will long survive in monitoring, in evaluation, in implementation of programs, in interaction on a free and fair basis with the private sector, with the non-governmental sector. The issue of veterinary advances is very important, and livestock is key. And one of the things that we've tried to do but have struggled because of the lack of attention and dollars is to increase the veterinary capacity to understand and control veterinary diseases. And obviously the animal-human interface is crucial to ensuring health in these places. So I think what I would like to leave you with is the concept that the government is an indispensable partner, but can never do it all itself. And it's so important that we have the kind of collaborations that all of you are living, working, and striving for in public and private sector, global and US efforts, research and development and implementation, and we're just delighted to be part of that effort. So thank you all very much. I'm sorry I have to step out now.
Thank you for being with us. Jada, there's a number of issues around the US policy implementation. If you could touch on those, and then I'll ask Mark to close with his response to whichever of those questions.
Perfect. So I'll try to go down the list and capture as much as I can. I'll echo Tom's agreement on, Africa is not a country, and I think we've tried to be very specific in talking about specific countries as we go through. There is no scenario where rice is dumped in Tanzania. Anytime U.S. food is brought in, there's been exhaustive analysis that's done on the local market, what foods are available, to make sure that whatever products are coming in will not compete with local markets, and that they are, and so that leads to certain crops not going certain places, but other crops going certain places in times of the year where we might bring in food. So we act very responsibly when we do bring this kind of gift to the American people to different places. And like I said, there are situations where, especially in emergencies, where only imported food is definitely the best scenario in that case. We believe in open and fair policy and trade regimes. We try to build capacity in our local governments and in the partner countries where we work to help them bring their own policy capacity up to speed so that they can be effective negotiators on their own behalf in situations, but that they can also create local policies that benefit their people. We agree that livestock plays a huge role. There was another question about the perceived corruption in government versus social institutions. We work through both. We work with governments where government is a willing partner. Very few U.S. government resources go directly into government. We might support specific government institutions or initiatives under very careful monitoring and evaluation, and we also work with NGOs and partners. So we do believe in a comprehensive approach and very much are careful stewards of our U.S. funds. The question from Adizia, we're very familiar with your work, and part of our food aid reforms and our ongoing commitment to nutrition have been to improve the nutritional qualities and the use of ready-to-use therapeutic foods in our intervention basket. There's legislation and appropriation. Both are very important to what we're trying to achieve. I don't want to comment on the specifics of the Royce bill, but I think they're both trying to go into a same complementary path, and we welcome all the efforts.
Thank you. Thank you. Mark,
Great.
would you like to give us your closing thoughts, and then we can move on to...
Okay, well, thank you, and a great set of sort of questions. So let me try and touch on a couple of them. And a couple of questions just about media and social media, and I think, absolutely, we're both in the traditional sense of how do you get better and more comprehensive coverage about these issues, both of the challenges and the opportunities and what's happening. And in fact, we've supported some efforts in a number of African countries to actually help train journalists and others better to comment and write about these issues, because they're huge parts of those countries' economies, but like elsewhere, journalists tend to live in urban areas and don't think very much about these issues, and so there's an ongoing challenge there. And then also sort of social media efforts about use of radio. So into mobile phone technology, you forget that radio is actually the best way to reach most smallholder farmers in both sort of India and much of Africa, and various tools and techniques. We have one interesting one that goes to the training question called Digital Green, which we operate in India and is piloting now in Africa, which helps actually create in a very low-cost way local farmers who have some of the best practices about how to farm sustainably, what to do, who get taped and videoed and speak in their local languages, and those videos are brought around into other local communities, sort of a peer training mechanism. And that, again, has been a fairly low-cost, highly effective way of reaching many, many people at scale. So lots of exciting experimentation going on, and we're hugely supportive of it. In terms of the general, I won't talk to the food aid issue, which Jade has answered, but to the wider issue of the WTO and sort of food policies, I think it is clearly true that one of the areas where international trade negotiations have repeatedly failed over the last 10 to 15 years has been around the sticking point of agricultural subsidies in food. And again, without going deeply into the details, it is clearly a fact that the existence of large-scale agricultural subsidies across very large corners of the rich world, across Europe, Japan, Korea, including areas in the United States, is a problem that distorts markets and makes it more difficult for poorer countries to compete actively. And so we hope that that's an area that can see improvements in the future. In terms of school systems, there was a brief comment there. Just yes, in both the training and education, but also we have interesting programs such as one we do with the World Food Program, which is called Purchase for Progress, which actually uses purchases emergency aid from local farmers. So it's again, how do you create and strengthen local markets, many of which often get turned into then school feeding schemes in countries like Ghana or others. And so you can see an interesting connection there, because the school feeding improves nutrition of the pupils, but you're also creating virtuous cycles of markets back with the country. And then maybe just to close back with that comment on Africa, which everyone's commented on, and I hope certainly that one of the really good things that you take away from the work that's been going on in this area is that that's really completely understood by, I think, both the governments, the US government and others, and partners like us. And in fact, we were using examples. I was using a Tanzania specific example, or our work in Ethiopia. Nigeria came up, and in fact, we now have extensive partnerships growing in Nigeria, because Nigeria has recently appointed a very dynamic agriculture minister, Akina Desina, who has some very ambitious plans around this, and when and where there are areas to come in, and partners who appear, who are doing this stuff, we absolutely want to come in behind that and support it, and that's where we see the energy. And linked to that question about the start of the state, of how do you work with governments that aren't really doing this? Well, from the Gates Foundation, we're in a slightly lucky position. We tend to self-select. Our partners are those who really want to be partners and who are doing the right thing, and we're able to come in with our own other network of partners to support them, and hopefully those positive examples and the momentum that takes place becomes a really encouraging example for their peers. And we're actually also in the process of working with the African Union at the moment in Africa to try and help them become a network that looks at and identifies some of these champions, like in Ethiopia or Tanzania, and helps spread those best practices across other African countries to take it up and drive it forward. So maybe my closing concept, which I should have said before, for all, we've had a good cross-section talking about some of the challenges as well as the opportunities. You're really, from where I sit, our glass half empty person is left, so I'll say it, for me the glass is very much half full and filling rapidly in the space. I think we are getting better. I think the attention is getting sort of more focused among both the key donor countries and the developing country partners. We should be implementing the upcoming next G8, which is taking place in London in a few weeks, actually has a session, they're calling the pre-8, a week before, which is going to focus on exactly this link of food security and nutrition and hunger. We'll be making some announcements there, so some other big donors will be too. And I think that's all part of that same momentum. And actually there, one of the interesting partners is going to be Brazil, which is arguably the country that has the best track record in the last 15, 20 years of combining both agricultural growth and massive improvements in nutrition. And they're looking to that as a leadership role they can play heading into the upcoming World Cup that they're hosting. And they're also starting to work in Africa. So all of these things, there's an incredible amount of momentum, new actors, new models, a lot of excitement and energy. Very long way to go, but we're incredibly heartened at the progress and action, and I'm very hopeful that all of you will come out of today's session and today's action sort of both energized, but also seeing some great opportunities to get and stay involved in this going forward. So thank you very much.
Please join me in thanking our speakers.